Hello, welcome to the third of my series of three videos introducing the three areas of expertise in my practice. The first was on craniosacral biodynamics, the second on continuum movement, and this one is on pre- and perinatal psychology, or prenatal and birth therapy. So this area has been a huge passion for me from actually before I got into biodynamics or continuum. And it's a very interesting field. Basically, prenatal and birth psychology is looking at our experience before and around the time of birth. Prenatal, before birth. Peri means around. Natal means birth, around the time of birth. So some people consider it to start at conception or even before, and some consider it to continue for 9 months or even a year or more after birth. So it's about our very, very early experience and how that affects us throughout our lives. Now, that's a paradigm shift just to consider that our very early experience can affect us throughout our lives. For many in our modern Western culture, that just isn't something they would consider. The field of pre- and perinatal psychology has really developed out of the surprises that many practitioners, or at least several practitioners, experienced in their therapy practices, where their clients were talking about or expressing in some way experience that they felt was from their birth or even before that. So we're not supposed to have memory that early. We don't have fully developed brains even when we're born. Our brains are quite immature when they're born. And certainly before we have a nervous system, before we're born, even at conception, how could anyone remember that? And yet it's clear that we have some kind of consciousness. We are sentient beings from the very first moment, if not before. If you listen to my video on craniosacral biodynamics, I talk a bit about the energetic fields that have been found, scientifically found recently, to precede our physical existence. And practitioners have known for years, for a very long time, that we are energetic beings. There are many practitioners who sense that, but science is catching up. And what it also is catching up on is something that parents have sensed throughout the ages, at least in some cultures, that their little ones are very conscious and aware beings. They may not think the way they do. They're not capable of speaking and using words the way they do, although there is evidence that they understand words, and certainly that they recognize voice. A newborn recognizes its mother's voice almost immediately and recognizes her face immediately. Now, how is that possible when the newborn hasn't actually physically seen the mother's face before being born? And yet, we are capable of such recognition. We're capable of very intelligent behavior, of memory, of intelligence, long before we can speak and long before our brains and nervous systems are fully developed. So these findings have been a challenge for many. And personally, I found it quite fascinating. I was introduced to the field of pre- and perinatal psychology through my studies in somatic psychotherapy, dance movement psychotherapy. I was at the Naropa University. It was actually called the Naropa Institute at that time. I began in 1993 working on my master's in dance movement psychotherapy. And we were introduced to this field because it's not really possible to work with the body and with movement without encountering very early experience being expressed through the body. Our bodies remember, even if our conscious minds don't. We learn how to not consciously remember such events that occur to us very early. And so they become shadow. They become something that lurks in our unconscious and affects us in many areas of our lives. Our personality structures, our style of communicating, of relationship, our interests, our choice in occupation, our self-image, our body image. All of these can be affected by very early experience. At birth, for example, baby is born, and I was told that my father said, "Oh, she's so ugly." Now guess how that affected my sense of how I looked. Another child might be born and parents go, "Oh my God, it's a girl," or whatever. They wanted something else. Our sense of being welcomed and belonging emerges from how we are welcomed at birth. And even before that, how are we welcomed and acknowledged at the moment of discovery, when the parents discover they're pregnant, when the pregnancy is confirmed? How do the parents respond or react? We know that more than half of pregnancies are not actually planned. Even if the parents really want to have a child, often there's some experience of ambivalence at the moment of discovery. Like, "Oh, am I ready for this? We wanted to save a little bit more money. We were just about to go on a vacation to India." I've heard many stories. One of my mentors in this work was William Emerson, who's a pioneer in the field. And he would say that anything less than celebration at the time of discovery is shocking for the little one. I'm going to pause here, take a moment to consider that, because most of us weren't welcomed and celebrated in that very first moment. There's so many other influences when we're very, very little. A cell has memory. A cell has intelligence. And we also know that energetically we have intelligence. There's some kind of energetic intelligence that forms us in the first place. We don't know how that happens. And yet here we are. We've all evolved from one little tiny cell into these magnificent complex beings that we are. We have within us the memory of that potential, which is what I am most interested in tapping into. And I mentioned in my last video that I'm writing a book called Fluid and Cosmos, accessing our original embryological potential. Because when we're that teeny, we can become almost anything. We have incredible potential that enables us to grow into this. And yet there are many difficult influences as we go along. Conception itself is often not the most conscious event on the part of the parents. It's not unusual to be conceived under the influence of alcohol, for example. And so the child is coming into a somewhat unconscious, not necessarily welcoming environment where they're not prepared for. We can have much more difficult kinds of things happening to us, like where the parent really feels they cannot have the child, want to give the child up for adoption, or have thoughts of abortion or attempt abortion. Those are very extreme kinds of rejection for the little one. And they're understandable, often they're necessary. But what's often forgotten is that there's a little tiny one inside who is responding to all that. We actually do have awareness when we're that little. And people have memories of an abortion attempt, for example. even if they don't have conscious memories, they may be acting as if they were in danger of being annihilated throughout their lives. And so their system runs on hyper alert. They're always on the lookout for danger. It's hard to get close to them. It's hard for them to have relationships. I'm not saying that the parents have done anything wrong. Something that I learned early on when I was just so passionate about all this information that people immediately went to, well, I didn't do anything wrong, or, it's nobody's fault. And it never occurred to me it was anybody's fault. But that's where people go to. The shame that we experience or are exposed to very early acts through us unconsciously, perpetuates within us, so that we immediately go to shame and blame often. That wasn't where I was coming from. I was excited about this information. But I've learned that I need to underline that this isn't about it being anybody's fault. Even if an abortion needed to happen, if it was that extreme, or adoption, it's very easy to actually just talk to the child and support them in being able to move through the experience so that it's less traumatic and less shocking. For a little one, having their mother consider getting rid of them is life-threatening. Little ones are absolutely dependent on their caregivers. And if the caregiver isn't responsive to their needs, isn't recognizing them, isn't acknowledging them, isn't present with them, that is appropriately terrifying. And little ones go into shock. They freeze because there's not much else they can do. And then they end up living like that, or quickly resorting to being frozen and dissociated throughout their lives. I notice I slipped and said our lives because I spent the first 20 years of my life living from here up. I also had very extreme allergies. And through doing extensive prenatal and birth therapy myself, I was able to clear a lot of that. I realized that I had grown in an extremely toxic environment prenatally as well as after birth. I was conceived and born and lived the first 5 years after birth in a town which is now considered one of the most toxic in Canada. I recently read that it has the most particulates in the environment of any place in Canada. It's called Sarnia in Ontario, by the way, so you may not want to go there. But for me, it meant that my entire system was bathed in, marinated in toxicity, chemical toxicity. There were several petroleum plants in Sarnia. My father worked at one. And so my system was physically surrounded by that, as well as having a family environment that was very unstable and not very welcoming. So my system was operating on fear, as well as having all of this chemical toxicity within it. They say allergies are about fear on a cellular tissue level, the body trying to get rid of what it perceives as dangerous. Much of that for me came out of my very early experience before I was born. My experience with pre- and perinatal psychology and therapy was hugely transformative. As I mentioned, I was introduced to it in my master's program at Naropa in dance movement therapy. Before that, I was practicing massage and body work, and I was having people birth themselves off my table unexpectedly. I remember having actually 2 different male clients who were both well over 6 feet tall. And if you know me in person, you know I'm quite short. And somehow I was able to support them as they spontaneously started to move off the table head first down onto the floor. I found myself being a midwife, and I didn't really know why this was happening. The next year, when I went to Naropa and was introduced to pre and perinatal psychology, I started to understand. When I was introduced to pre and perinatal psychology, I found myself just so fascinated, so compelled. I felt like I needed to continue to study this work, and I actually went on to get a PhD in pre and perinatal psychology. That's not an easy thing to do, by the way. There are no schools that I know of that offer that degree. I knew one person who had the degree, actually William Emerson introduced me to her, and she had created it herself. So I ended up going to the Union Institute in university, where you can create your own program. And I created my own curriculum in pre and perinatal psychology. As part of my studies, I studied with William Emerson for 6 years, and then went on to study for another 4 years with Ray Castellino, another pioneer in the work. And both of them work with prenatal and birth trauma and shock with babies and children as well as adults. The work I've done with them, as well as in my somatic psychology training, highly influence everything I do. And actually, as part of my studies in pre and perinatal psychology, I decided it was really important to study embryology. Because when we're so little, our bodies are constantly changing. It's something like being a teenager, where the body is constantly changing. Learning is happening through the body. It's not verbal or intellectual at that time. I just felt it was essential for me to study embryology. And so I found a way of studying embryology through movement, and have been teaching what I call embodying embryology ever since. I do that these days through continual movement. But I find that that information influences everything I do. So there's, again, much more I could say about this field. It's a huge field that has many branches, has some interesting history, and influences all of us in probably every part of our lives, because all of us have been born, all of us have been through it. They say, that where you're not aware of history, you tend to repeat it. And I see that as applying with our prenatal and birth history as well. Simply becoming aware is a first step in healing. And there's so much more we can do with that. So I think I'm going to keep it short and leave it at that, and invite you to submit any questions that my little talk here may have inspired. I'm aware that talking about this, if you're not familiar with it especially, could stimulate some feelings and reactions. And so I want to encourage you to be gentle and kind with yourself. And if you have some kind of practice that supports you in resourcing, perhaps some kind of meditation practice, maybe you want to look at my continuum video and do the little continuum piece that I offered there. Go to a craniosacral therapist. Let yourself find a place where you can be settled and present. And in that place, there's the possibility of some very profound healing of this early material occurring. The last thing I want to say about this field is that when I first started learning about it, we were doing quite cathartic work. And that certainly enhanced awareness. I'm not sure how much it actually led to healing. These days, we know a lot more about working with trauma. And we know that it's important to not go into the trauma, because we can get lost there. And it can be hard to get back out. It can be hard to actually heal in that state. So I want to emphasize the importance of being in present time, taking care of yourself, letting yourself be taken care of as you explore this material. And I would love to accompany you on that journey and wish you the best with it. Thank you.